Hey guys, Professor Costa again. So today we're going to be talking about, first part is medications affecting nutrition, antiemetics, and emetics. All right. Okay, so vomiting. All right, so the cerebral center is affecting vomiting. The first one is the vomiting center, and that's odors, smells, taste. You smell something that makes your stomach, turn and you can vomit. Then there's the chemoreceptor trigger zone, and that's drugs and toxins. I like to think of chemoreceptor and chemotherapy just to remind patients students that that's a common cause in the CTZ, right? Then there's also the vestibular center, very small, segment where you have someone with vertigo, for instance, where the world keeps spinning. And those patients have to be treated with antiemetics as well, okay? Okay, so we always want to start with the non-pharmacologic measures if we can. The first one is the so-called brat diet that we always hear, the pediatricians tell if you're a mom or dad, and that's the bananas, rice, applesauce, and toast. And that's also good if you're at the tail end of, let's say, a gastrointestinal infection and you've had, this quote unquote stomach flu, and now you're starting to be able to take solid foods again. Those are the good ones to start. You don't want to go right out to Taco Bell and get, whatever designer Bordito or whatever they have. But non-pharmacologic measures, weak tea, flat soda, gelatin, Pedialyte, Gatorade, crackers, toast. We want to start with the non-pharmacologic measures first. No Taco Bell. All right, so here's a nice, I think, succinct table. I didn't put the table number for the new book, but if you look on your syllabus, you'll see the correct chapter for the 9th edition instead of the 8th edition. 42-2 is in the 8th edition. All right, so antihistamines. Believe it or not, those work really, really well. And the reason for that, as you know, in your stomach, we have histamine receptors. Those are the H2. And some of the antihistamines are really good at affecting both the H1 and H2. Okay, so hydroxyzine is one that's used as an antiemetic. Hydroxyzine is used for lots of different things, actually. It's used as sedation because histamine is part of that sleep-wake cycle, and so that one is non-selective, and it hits both, and you can get really, really sleepy. And promethazine, which is in multiple, it does more than one thing. It's technically an antihistamine, but it does also block dopamine. Okay, so hydroxyzine and promethazine, they're antihistamines. They're going to make you sleepy. That's one of the, not always a bad thing. If I have a patient, now I deal a lot with oncology patients undergoing chemotherapy, or I deal with, expectant moms who are admitted for hyperemesis gravidarum, or, morning sickness. So you've been vomiting, you can't stop, we give you a medication. Sometimes a little nap isn't the worst thing that can happen. But just remember that some of these medications can cause sedation, all right? A bismuth subsalicylate of Pepto-Bismol, our good old friend Pepto. Scopolamine delivered as a patch, that's an anticholinergic. Okay, we have prochloroperazine adicillate and promethazine, and those are our dopamine antagonists. We have our good old friend lorazepam, benzodiazepine, that works great for chemo-induced nausea. Ondansetron, or a serotonin antagonist, Zofran, I'm sure most of you have given that at least once. Dexamethasone, which is a glucocorticoid or a steroid. Dronabinol, or a cannabinoid, or weed in the street version. And then the metoclopramide, which is a miscellaneous class. Okay? All right, so antihistamines and anticholinergics. So the ones that we're looking at are hydroxyzine, which is Vistaril, a scopolamine patch, all right, promethazine or Phenergan. These side effects include drowsiness, dry mouth, especially with the scopolamine, blurred vision, which is caused by pupillary dilation. With any anticholinergic, you can have tachycardia because an anticholinergic blocks that parasympathetic response, and constipation, right? Again, because of that anticholinergic action. Remember, the parasympathetic nervous system is rest and digest, and we're blocking that so we can have a fast heart rate, and we can have impaired or slowed peristalsis, which can cause constipation. These drugs should not be used by patients with glaucoma. That's the big picture of the eye. Okay? So again, an anticholinergic. Contraindications are glaucoma or paralytic ileus, tachycardia, myasthenia gravis. Side effects include blurred vision, pupil dilation, weakness, insomnia, dry mouth, constipation, and urinary retention. An example of an anticholinergic in general is atropine. So the saying is dries you out like a desert. And here's my so anticholinergics: can't pee, can't see, can't spit, can't shit, right? So those are the common things that you need to keep in mind with an anticholinergic medication. A dopamine antagonist. Okay, so these include our prochlorperazine, adicylator compazine, and promethazine or Phenergan. So those include moderate sedation, hypotension, extrapyramidal symptoms. So be very mindful of this. This one can cause extrapyramidal symptoms and central nervous system effects, and a mild anticholinergic symptoms. All right, mild anticholinergic. Okay. Good old Pepto. Every time I see the name, I think of that commercial where they're dancing, almost like a line dance. Anyway, bismuth subsalicylate. So it acts directly on the gastric mucosa to suppress vomiting. A very common side effect is it turns your poop a dark color, almost black, and it can look like melena or melena. So just make sure that your patients know that it can change the color of their poop. You're going to avoid concurrent use with other salicylate medications such as aspirin. And high levels of this, just like aspirin, can cause ringing in the ears or tinnitus. It's also used as an antidiarrheal, so if your patient is already constipated, this is not the agent you want them to use. Right? And the normal adult dose is of Pepto, the liquid, is 30 milliliters, which is about 525 milligrams. All right, benzos, who knew, right? So lorazepam effectively provides emesis control, sedation, anxiety reduction, and amnesia when used in combination with a glucocorticoid and serotonin. So lorazepam is used often in the oncology environment, and it can help with, these patients have multiple things going on, and one of them is nausea, and Ativan works quite well for that. A serotonin antagonist, ondansetron or Zofran. A lot of people don't know that the most common side effect is headache, diarrhea. Not surprising. Anytime we give a medication that affects the GI tract specifically, other parts of the GI tract can be affected. So diarrhea, it can also cause dizziness because we're dealing with serotonin, and fatigue. All right? Okay, glucocorticoids. So dexamethasone, which is called Decadron. It's administered most commonly IV, but it is also available PO. All right, so it's effective in suppressing emesis or vomiting associated with cancer chemotherapy. And it's also so commonly used, it's very commonly used by anesthesiologists prior to surgery. So they usually give a cocktail of antiemetics. So Reglan's one of them, or it's, Reglan, Zofran, and Decadron are commonly used as a trio of medications to prevent nausea from anesthesia. Okay, cannabinoids, dronabinol. So the active ingredient is tetrahydrocannabinol, or delta-9 THC, and it's the active ingredient from pot, right? So it was approved for clinical use in '85 to alleviate nausea and vomiting resulting from cancer treatment. So this isn't the actual plant. This is, they've taken out the chemical and put it into a pill form. It's a controlled substance, so you have to count it if you pull it out of the Pyxis. It's contraindicated for patients with psychiatric disorders. Okay, and just like pot, you can have mood changes, euphoria, drowsiness, dizziness, headaches. So it helps with nausea, and it also promotes appetite, which is why it's used in the cancer population, almost exclusively. For HIV patients too, I should say, and stage 8 patients are often given this. My patients tell me that smoking the real product helps better, but for people that are leery, there is a pill form of this that is completely legal, and There's no like problem with getting a prescription for this. All right, so Reglan or metoclopramide, that acts to suppress impulses in the chemoreceptor trigger zone, the CTZ. And again, it's used for postoperative emesis, so throwing up after you've had surgery, cancer, chemotherapy, radiation. High doses can cause sedation, however. Low regular doses don't, I haven't seen too many people like get conked out, but a higher dose can cause sedation and diarrhea. Extrapyramidal symptoms are more prevalent in children than in adults, okay? So, and also it's a prokinetic in addition to, helping to treat nausea. What does that mean? It can increase peristalsis, a prokinetic. So if they have a GI obstruction, like something's blocking, you don't want to irritate that even more and cause them more pain, so it's contraindicated. If they have a hemorrhage or a perforation anywhere in the gut, we do not want to give them metoclopramide. Emetics. Now, the only reason I'm including this is actually contraindicated for use nowadays, but just, I don't know, things swing and sway, and just so you're aware of what it is, Ipecac. Every mom in the old days used to have this in their medicine cabinet. It stimulates vomiting, so it makes you vomit. You have to take it with a big glass of water, and vomiting will occur within 15 to 30 minutes. They used to tell if your kid swallowed something you thought was poisonous, you'd give them Ipecac and make them puke it all up. Nowadays, we have better methods, like we could do a gastric lavage, which is a lot safer than making you throw up at home. And you would never induce vomiting if you thought that the solution that they swallowed was caustic or oil-based. Because they could actually inhale and that into the lungs, and it'd be a way worse situation. So nowadays we use gastric lavage or activated charcoal or both. So they don't tell you to take this anymore, but I just wanted you to know what the product actually was. Okay, the second part of this is IV flow rate calculations for dosage per time. And I'm going to stop this here, and you're going to see another video from Professor Stankiewicz, a medial file, when she goes over these calculations, because she does a much better job of explaining this.